The three most common entities or injuries or diagnoses that I see in my office would be number one, cervical disc herniation or cervical spinal stenosis. And what that means is that there is a disc herniation in the neck that's pushing on either the spinal cord and or the nerve roots that's in pain down into the arms with numbness, tingling, weakness. Sometimes people will even have some difficulty with their handwriting or buttoning buttons, or they may notice some instability or shuffling in their gait. The second most common thing I would see in our office is lumbar spinal stenosis. And lumbar spinal stenosis is when there is too much pressure on the nerve roots in the lumbar spine or the lower back. That can lead to symptoms such as low back pain, pain that radiates down into the bilateral buttock region or buttock on either side, sometimes down into your lower extremities or into your legs. Generally, that pain is going to get worse with standing and walking. It gets better when you sit down or lean forward. Third most common thing I would see in our office would be a lumbar disc herniation. And in lumbar disc herniations, generally the symptoms are pain across the low back, extending down into one of the legs, either the right side or the left side. And generally there is some sort of associated numbness, tingling, or maybe even some weakness that goes along with that.